Okay, I'd like to invite our next speaker up. Associate Professor Rebecca Glauert is the Scientific Director of the RAIN Study and Principal Research Fellow at the School of Population and Global Health at the University of Western Australia. She's been instrumental in the strategic development of cross-agency data linkage in Western Australia. Rebecca led the development of the West Australian Child Development Atlas, a freely available data visualisation platform that enables community, researchers, policymakers and service providers with access to important data on children's health and development by geographical area. So, thank you.
Thanks, everybody. I'm anticipating a few technical issues, but let's just hope not. It's really lovely to be here today with so many like-minded individuals. What I'm going to talk about today is the Australian Child and Youth Wellbeing Atlas, which has been a really long journey, an over 10-year journey actually, which started after my work dealing with government agencies across WA mainly, and recognising that there was so much information and data held in government agencies that was really important to be used to look at the health and wellbeing of children and young people, but it was notoriously hard to get access to. So I'm going to be talking a bit about that. I'd just really like to acknowledge all of the partners who have worked tirelessly on the National Atlas. We have well over 30 partners. We've been funded by the Ian Potter Foundation since the beginning of the vision, which was probably in 2016, and the Australian Research Data Commons, who helped fund the actual creation of the National Atlas. So we've worked really closely with QUT and people across the country, and you can see some of their logos below. Now let's hope that this actually works. Oh, I think I can get back to the slide. Oh, okay, so it's not, okay, thank you. So, you know, we are the land of plenty, but our children and young people are certainly not doing so well. In fact, we're seeing these new morbidities increasingly rise, and it should be of great concern to every single person here. And these are preventable problems, particularly things like mental health. If we're looking at the mental health of our children and young people, it is significantly declining. We've got increases in obesity, we've got increases in cardiovascular issues, all of these things which are entirely preventable, but also which are highly complex, but we're not addressing them. And I think we're not addressing them because they're not out there enough. People aren't seeing them, they're not visual. It's not out there, so we can't put the pressure on. And we are very really facing the prospect of leaving this next generation in a worse situation than us for the first time. And I don't think anybody in this room would be happy with that scenario. I certainly wouldn't. And I think about my child and all of her friends and then her children potentially and what the world is going to look like for them. And I think we should be concerned, and I think we need to do something about it. And we can only do something about it if we actually can see what the problems are and we actually have that push and that accountability. And yesterday, Anne was talking about accountability, and I think this is one of the big problems we have here. There is no government agency accountable to the health and wellbeing of children and young people. There's no one who is advocating. So what is happening here? All we're seeing is a massive decline, and it's very concerning. So next slide. Okay. So we know that data on children and young people are held in multiple locations, but children aren't silos of government. They live entirely outside of those silos. And if we want to get an entire picture of children and young people, we need to bring that information together. They are complex. The health of a child impacts their education. Where a child lives impacts their health. A child's mother's mental health impacts everything about that child's trajectories. So we know this, and we know this because we've linked the data. We've linked health data to education data, to justice data, to housing, to all of those different data sets so that we can actually see what those pathways are and what those trajectories are. We know it's complex, but we have to actually look at the whole picture. And without a complete understanding and a complete picture, we can't address these complex issues. Working with researchers and policymakers across WA specifically in the first instance and now across Australia, I know that there are people in every single government organisation, in community organisations, researchers who are trying desperately to get access to these data on children and young people. And everyone says, oh, we've got so much data, we've got so much data. And yeah, we do. We actually have a huge amount of data, but it's not available. It's almost impossible to get. I've had PhD students wait 3 years to get access to data that already exists, and that is just to get approvals. So this is not acceptable, and we want to change it. And this is why we've created the Atlas. We're jumping through the hoops. We're going through the approval processes. We're getting the ethics approvals because we believe that the data needs to be made available to people who need it now, and it needs to be up to date, and it needs to be presented in a way that actually makes sense to people. I've been to so many meetings and you give presentations and you give graphs and you give tables and people's eyes just glaze over, particularly when we're talking to politicians, when we're talking to ministers. It doesn't mean anything. However, there's something really impactful about visualising, geospatially visualising data on children and young people because you can see it. You know, there's a big red blop there. Well, what on earth does that mean? You can't deny it. And once it's actually out in the open, and this is another thing, is that we're making it free. We're publicly available data. I know that there are groups around the country who are doing things around trying to, we're talking about democratisation of data, but then charging communities $20,000 or $30,000 to get access to the data. These are data on our children and young people. It actually belongs to us. Why are we paying for it, firstly? And secondly, why is it locked up? I think we have a moral obligation and an ethical obligation to utilise the information that is collected on our society to improve policy making and the decisions that are made around what happens to these children and young people. So what we are doing is we are providing a freely available, accessible data atlas to visualise, analyse and monitor the health and wellbeing of children and young people across this country. Most of the data that you'll see in the atlas is downloadable, so we've got a separate dashboard where you can actually download the data sets. Some custodians haven't allowed us to do that yet, but we're still working. It's a slowly. We work hand in hand with our custodians. When we released the WA Atlas, which was 2017, I mean, when we first started wanting to do this, people said, you can't do it, you can't do this, you're going to stigmatise communities. And I was like, I mean, you've got to be kidding me. You think that people living in a disadvantaged community doesn't know that they're living in a disadvantaged community? They don't know what's actually happening? Of course they know. All this does is shine a light on it and actually make people sit up and listen and enable people to call for the resources that they need. So community members, not-for-profits, can actually look at the data and say, look, we know there's a problem. Here's the evidence. Now we would like some funding to please address this issue. So I'm going to go into, and I really hope this works, our demonstration. Okay, if we can. So when you go to you can just Google Australian Child Atlas and it'll take you to it. So you come up with this page, and excuse the, it's a little bit difficult with this mouse. All the data at the moment are on a national scale. So we have mainly a lot of national data sets. In WA, we have a lot of state-specific data sets. That's because we have the WA Atlas, which has now been ingested into the National Atlas. And our plan going forward is to have every state and territory's specific data sets. So everything's on a national scale. So where you've got the sort of pinky, reddy colours, it means it's higher than the national average. And the blue means it's lower. Now, that's not good or bad. It just depends upon the data that you're looking at. So, for example, if we're looking at immunisations and we've got a lot of red, that means that we've got a lot higher percentage than the Australian average. So we've got a lot of kids there who are fully immunised. And if you've got blue, it means you've got a lot lower. However, if you're looking at something like emergency departments for deliberate self-harm, then you've got red, where you've got a lot higher numbers of children and young people being admitted to emergency for deliberate self-harm, and blue means lower. So you've got to think about the actual data that we're looking at here. So you can explore the atlas using the menu here. So everything in the atlas is based around the Eracy nest domain. So we heard from Roz yesterday around the nest, which was conducted, it was a consultation with over 4,000 people. So we thought that was a really great framework to work with for the atlas. We have over 500 data sets in the atlas at the moment, and they're all allotted to a specific domain. So it's healthy, material basics, learning, etc. You can disaggregate by age and gender in some instances. We have different years. So here on the calendar, you can select the year of the data that you would like to look at. Here on the map of Australia is the level of geography. So the smallest level of geography we go to is SA2 or Statistical Area 2, which is around about a suburb. And then we go up to Statistical Area 3, local government area, and in some instances, state. Obviously, the more granular data you get, a better picture of what's actually happening in that area. However, we suppress values where we've got low numbers. So under 5, the values are suppressed, and that's for privacy preserving reasons. And we also have on the right here, this is layers of service, so you can actually look at where particular services are located. So when you open up, you can see this is the map of Australia. One of the things that I like to start off with is something really simple, which is, where are the kids? Where do they live? Number of children and young people aged 0 to 5 years across the country. So you can click on a particular area and it will take you down to the national scale here. So it shows you that little black dot is where that particular area sits. And here the national distribution. Let's say we want to go to an area where we've got high numbers of young children. It tells me here that particular area has high numbers of children. This is 2006. So if we scroll on up and see, well, how has this changed? Sorry, it's just trying to zoom. So then I want to change that to the most recent data that we have available here. So 2021. And we can see here, we've got areas where we've got really high numbers. And you can see how that area has changed over time. So from 2008, 400 children, to 2021, nearly 7,000. Now this is really important actually, because where are we putting our schools? Where are we putting our child health nurses? Where are we putting our services? We really need to know this. And then if we're looking at things like health, so we want to look at health at birth. So preterm birth, for example, children born early, we know has significant impacts, can have significant impacts on a lot of their outcomes. So if we're looking at children born less than 37 weeks, I'll go to the most recent data. And you can see how this varies across the country. So if you look up here, we can look at Tiwi. And we can see how over time this is actually increasing. And I don't think that's a good story. I don't think that's what we want to be seeing. So where are we going to be putting in our prevention strategies? And this is why we need to have access to this type of information, and having it geospatially mapped is really important. So looking at the Measuring What Matters framework, one of the indicators, there would look like only really two indicators that were looking at children and young people. The AEDC, so the Australian Early Development Census, so children who are on track, and it was a percentage. Oh, it's going up, it says it's improved. Is it going up? Where is it going up? Is it going up everywhere across the board? Or are we just talking about going up in general? Because we know that the disparities continue, and actually they continue to get worse. So if you look at combined domains, children who are developmentally vulnerable on 2 or more domains. The percentage, this is 2009. This is 2021. So in some areas we might have seen improvements, but actually in a lot of those areas where we're seeing a lot of deprivation and disadvantage, we're not seeing the improvements that we want to at all. So what you measure matters, and we need to ensure that we're measuring the right things in the right ways. And you can actually look at this in a more granular way. So, okay, let's go down to statistical area 2, and you can look at these particular areas here. And you can see here, we've actually got increases in the number of children who are developmentally vulnerable on 2 or more domains in this area. So we can't just look at the overall figures. It's a complex picture, and it's not enough to just be saying we're going to see improvements in AEDC and those who are on track or not on track, because we need to know where, and we need to know what are the influencing factors. I'll just give you another example of the things that we've been doing. So in WA, we have access to hospitalisations by type of hospitalisations for different age groups. And this is what we're trying to do across the country from now on, but is really being able to disaggregate the data down to levels that are actually really important. So, you know, there's nothing in the measuring what matters around mental health, and we know that this is a massive problem for children and young people. And, you know, people say we don't have data. We do have data. There is data available, but it's just hard to get. So if we look at hospital admissions, actually I think this is by under mental health, we can actually disaggregate it . So hospital admissions due to deliberate self-harm. So 10 to 24-year-olds. That's 2004. If we go to 2018, we can see this variation here. So we can see that there are particular areas, for example, Narrogin, where we've got actually quite high numbers of hospitalisations due to deliberate self-harm for children and young people aged 10 to 24. That's concerning. These are the numbers that we should be looking at and wanting to be reduced. And one example of how we know that the Atlas has been used previously was by a group who were doing is an early years partnership, which is partnership between researchers and not-for-profit, looking at particular areas around WA. And they looked at the hospitalisations for this particular area. And what they found was, now this is going to be a hard one, look, there's 97, there's a lot of data in here. And this is one thing that we're actually working on, is how to consolidate it or present it in a way that's a bit easier. So this is just, again, this is where we're sort of, we want to say pilot. We're developing the platform at the moment. Over the next year, we've received some funding from the Minderoo Foundation to really develop the platform and some of the functionalities, so that people can literally press a button and get a community profile of how the children and young people in that area are doing. You know, a little infographic, people love those sorts of things. But this was around oral disease admissions for children and young people, for children actually, just aged 0 to 4. And you can see here, there's a bright red dot. So that's Katanning, where one of these areas was. And so they thought, well, you know, what's happening here? This is terrible. Why do we have 0 to 4-year-olds being admitted to hospital for oral related disorders? And so they actually went into the community and they found that there was no dentist there for kids. And then what they did is they actually lobbied some philanthropic organisations, and they got the university dental students and a dental bus into that area to actually go and address it. And apparently what they're seeing is actually horrific, but now they have the service. And I think this really demonstrates the power of having access to data and actually enabling access to data to community so they can advocate for themselves. All right, so I'll get out of that, and if we can just quickly flick to the slides, I'll flick through them a bit. Okay, I'll just flick through that and that. So just in terms of how we've had a really strong children, young people advisory group on this project. So they've walked with us the whole way through, and also an Aboriginal and Torres Strait Islander data governance and sovereignty group. So you'll notice the data at the moment are not disaggregated by Aboriginality. That is done for a reason. This needs to be done appropriately and it needs to be led by our Aboriginal colleagues, and they will be doing consultation across the country to work out the best way to do this. We have ethics approval from the WA Aboriginal Ethics Committee, but we've heard long and hard about how people are sick of this deficit-based narrative around Aboriginal young people, but also that they want access to the data and to show how we're going with closing the gap, etc., which is not good. We know that. But we need to do that led by Aboriginal people, and that is what's happening with the Atlas. I'll skip through that. So this is what I was saying about the measuring what matters. So the early childhood, the proportion of children who are developmentally on track, it's not good enough. We need more information. I mean, that's easy to report, that's improved if you're looking at over the country as an average, but where is it improving? Is it only improving in the areas where they've already got access to everything they need? Probably. So I'll skip through that. So on the website, there's actually a user guide and information on all the data, so on all the resources, all the metadata, etc. And this is just an example of the little snapshots that we created these ones by hand, but what we're doing now is actually creating like a reporting function, so you can literally click on your particular area, whether it's a suburb or an LGA, and a little PDF will pop up with those key indicators and people can print them out. And you can take that to your members of parliament and say, look at what's happening here. We need help. So look, just in terms of, the future, we're really thrilled to have received some money from Minderoo for the next year. So we can start working with our other states and territories and getting the more granular data and really developing this platform so that we can have automatic reporting as well as those infographics and things like that. So I actually just found this yesterday, the zero draft of the Declaration for the Future Generations. So recognising that our decisions, actions and inactions today have an intergenerational multiplier effect such that our conduct today will impact future generations exponentially, and therefore emphasising that present generations carry a responsibility towards future generations to act with their interests in mind. And I implore you all to think about this as we leave here today at the end of this conference. We are responsible for what happens to our future and our future children and young people, and we can do something about it. And I think, I'm speaking to the converted here. It's a room of friends and like-minded people, but I think as a voice, we can do something about it. But democratising data and getting the information out there in a usable way is critical to us telling this story. Thanks.